Now, residents in the Eastern Cape have raised concerns about the deteriorating conditions of some of the healthcare facilities in the rural parts of the province. Most of the facilities were built by missionaries over a century ago. Their dilapidated infrastructure has led to community protests, with residents demanding that the facilities be renovated or rebuilt. Siyanda Manana, Eastern Cape Health Department Communications Director, joins us to expand on this conversation. A very good evening to you, Siyanda. Thank you so much for your time. I mean, a show that residents are clearly fed up. They're demanding better services. What is your reaction to this?
Good evening, and good evening to all the viewers. Yes, it is true. We do have those sporadic uprisings where communities, demand that we upgrade and refurbish facilities in the Eastern Cape. Remember, we had the former Transkei as well as the former Seskei, and in those areas, infrastructure was neglected in terms of health facilities and also other facilities as well as roads. So that is the part that was really neglected by this government. So right now, what we're trying to do as the health department is to ensure that the facilities are state-of-the-art facilities. We are doing that in a very staggered fashion. We have, for example, Futong Hospital, which was built, using lots and lots of money, millions of rands. It's a state-of-the-art institution. We also had the major clinic, which was built at millions of rands. We have St. Elizabeth Oliver and Adelaide Tambo Regional Hospital, built, large amounts of money, millions of rands. We also have St. Patrick's, state-of-the-art institutions. So money is really being channeled towards those institutions to make sure that they're state-of-the-art, that they can deliver service to the people. But
in the meantime, Siyanda, if you'll allow me, it happens as concerns are mounting on how well people in rural areas are cared for in these public facilities. I mean, you speak about state-of-the-art, but you really have not addressed my question around, what is the problem? Why has there been no attention paid to these hospitals in rural areas where already, I mean, the odds are against the residents and the community members, issues like poverty, unemployment, and on top of that, to have a healthcare system that isn't functioning, really that worsens the entire dynamic.
No, I wouldn't agree with you that the health sector here in the Eastern Cape is not functioning. Remember, I said that the part that you are dealing with, which is the rural part, is the part that was not that was not given attention in the previous dispensation. But I'm not making an excuse for that, because the money has been channeled towards those parts of the country. Even in terms of the recruitment of health professionals, we have then biased towards the rural part of the Eastern Cape. It's not something that we can, that we can address overnight. It's going to take time. Remember, we are also, faced with challenges here in relation to medical legal claims. The issue of roads is not something that really impacts on us as well, because if you are transporting a pregnant person to a health facility and then the roads are bumpy, there's no tar, then that impacts on us as well, as the health facility. However, let me take you back. We have the Greenville Hospital. It was built by missionaries. Now, you had communities going there and then, toy-toying and uprising, demanding that, we do something about that.
Yes.
That, right now, in end of March, we are going to be taking a contractor, and that contractor is going to be introduced by the Honorable MEC Tapa to the community of Greenville. The communities went there, then they barricaded the gate, not wanting to, people to access services. And we understand that. And we accept the fact that, we were not proactive in terms of communicating with the communities to tell them that we are going to be bringing the contractor end of
And why
March.
is that?
But
Why has there not been proper communication with the community to inform them of something that is so precious to them, wanting this project to commence? You have the information, but you're not telling it to the community. Why is that?
No, the problem was that during the December time, the suppliers closed, and then they opened later in January. So that time, and people had closed and so on at work. So there was really a lull during that period. So it did not really allow us and give us time. So when we came back to work to want to engage, the communities were a little bit, impatient. However, as I said, we apologize for that, and we are now in sync with the communities in relation to bringing the contractor in end of March to introduce it. Fortunately, during that period, it's going to be the new financial year, so we have then allocated money to ensure that we take care of that institution. That is not the only institution that we have, that has been built. Mm-hmm. You've got Mesonite. Mesonite is a very old institution that was built in the 1800s. Now, we have built a state-of-the-art nurses' home there, costing millions and millions of rand.
How much exactly?
We are now...
How much has been allocated to the renovations that you speak of? What is the budget that has been set to ensure that that hospital is indeed refurbished, as you say?
Which one is that? You're talking Mesonite?
Yes.
I'm not sure of the figure. Yeah. I must be honest, but I've been there and I've looked at the institution. I've looked at the nurses' home. It's a very beautiful nurses' home that really caters for our health professionals that are trying to attract and retain in rural areas. Now, let's move from there and go into major hospital, for example, major CHC. It's a community health center. It's got the state-of-the-art X-ray machines. Now, we have people that are moving from a major clinic and being taken through to Oliver and Adelaide Tambo.
Pardon me, Siyanda, very quickly, before we let you go, I hate to interrupt you, but I've got to ask you this as we wrap up. I mean, you keep mentioning state-of-the-art hospitals, but those state-of-the-art hospitals have failed to appoint CEOs. We know that Eastern Cape Health MEC, Ntandukazi Kapa, has failed to appoint CEOs for major state hospitals within the first 6 months of her term, as promised. I mean, I understand that only one hospital, Dora Nzinga Hospital in Nelson Mandela Bay, is the only one that, I mean, it's very well to speak about state of the art, but in terms of management, which is a sore point, how are these state of the art hospitals going to function without proper management?
Okay. Correctly so, we've got one CEO that has been appointed. The other CEO of Livingston, for example, we headhunted the CEOs. And 11th hour, then they declined. We went on to Tata, which is in the Nelson Mandela Academic Hospital. There we also conducted interviews. So in other hospitals, we are just waiting for the appointment letters to be issued, and then the candidates to accept. But the institution of Livingston, we are going to start the headhunting process so that we can then, appoint the relevant person with the relevant experience to run a tertiary hospital.
Okay, very well.
We say, okay.